Hello, my name is David Houlihan Burne. I'm a consultant orthopaedic and knee surgeon from Hillingdon and Mount Vernon Trust. I'm going to talk to you today about a little bit about the Trust, about myself, and more importantly about your knees and the updates in knee surgery. As you know, here at Mount Vernon we're about to open our new treatment centre in February 2009. Most of our orthopaedic operating will be done on this site. However, you will see us in outpatients both at Hillingdon and at Mount Vernon. Our number one priority in the treatment centre is of quality of care with a very low infection rate and a high standard of outcomes for you following your surgery. I'm a knee surgeon and I see many of you with knee pain of all ages, and we're going to talk about today knee pain in your middle age or in the elderly patients, predominantly which is arthritis. Many of you will experience pain within your knees from time to time and will have seen your GP or may well have seen myself or one of my colleagues about your knee. Knee pain varies in its severity and you'll often be referred up to see us here at the hospital if your pain is present when you're at rest or even at night, and particularly if your GP has already started you on the standard treatments of painkillers and asking you to walk using a walking stick, which I know many of you don't like. Once you see us here, we'll assess you to decide whether further treatment such as physiotherapy would be appropriate, and indeed some of you may also be appropriate to have some injections into the knee in order to calm down the pain and allow you to get back to normal function. For those of you that unfortunately have arthritis that is severe, you will require surgery to your knee if the pain is interfering with your life or your sleep or your day-to-day activities. There are a number of different operations that can be done for arthritis of the knee. Firstly, we can perform a keyhole operation to tidy up any torn cartilages within your knee, and some of you may be suitable for this procedure, although not all of you. If you've had this procedure and the symptoms have returned, or indeed if you're not suitable for this procedure, then we may offer you a type of knee replacement. There are many different types of knee replacement available, and here at Hillingdon we offer both full knee replacements and partial knee replacements depending on the type and pattern of arthritis that you have. Here at Hillingdon and Mount Vernon we are the UK leaders and in fact part of a European steering team promoting a rapid recovery programme for hip and knee replacement surgery. If we place you on the waiting list, you will go to one of our joint replacement schools where we'll encourage you to bring a friend or a relative who will act as your coach. They will follow you through the journey of your knee replacement, be supportive and participate both in the preoperative information giving and also during the surgery on the wards and in your recovery time. During this school you'll meet our physiotherapists, our occupational therapists, our pharmacists, our ward nurse and most importantly our anaesthetist. Here at Hillingdon and Mount Vernon we perform most of our hip and knee replacements under what we call a regional anaesthetic. This involves putting an injection into your back, and this numbs you from the waist down so the surgery can be performed with you asleep if you like, but without a full general anaesthetic and all the hangover and nausea that is associated with this. This means that we can get your knee or hip moving straight away, sometimes even in the recovery room, and if possible get you walking on your new hip and knee the very same day as your surgery. Having pioneered this technique, we found that our patients are now going home approximately 3 or 4 days following the surgery, whereas in the past, and in many other trusts in the United Kingdom, you may stay in hospital for 7, 8 or even 9 days. Obviously, being at home is a lot safer than being in hospital, and we're finding that our infection and blood clot rates are reducing with this new technique. We're also finding the satisfaction rates from the patients and the function of the joints to be very much better than in the past. Your surgery, you will be admitted on the day of your surgery when you will see one of the surgical teams who will then take your consent for the operation and you will go down to the operating theatre for your procedure. Again, you will have an injection into your back and you do have the option of either being awake or being drifted off to sleep during the operation. Following the surgery, you'll be taken back to the ward where you'll be given lunch or dinner, depending on the time of your surgery. And I would encourage you to start performing your exercises immediately, and if possible, our physiotherapists will get you up and get you walking. Depending on the type of operation you've had and the type of knee replacement you've had, you'll stay in hospital for either 2 or 3 days, being able to walk up and down stairs and independently care for yourself following the surgery. Many people like to see the type of knee that they're having, and this is an example of a half knee replacement. As you can see, we only need to replace the damaged half of the knee, and we can leave the normal half of the knee behind. This has very many advantages, particularly in the fact that it's got a moving part within it, and it mimics normal knee function very much more closely than in a full knee replacement. What are the advantages of this? Well, you can restore function very much more closely, and that allows you to return to normal activity and sport, and many patients tell me that they don't even know they've had any surgery to that knee. This is very different for patients who've had a full knee replacement, who will always know they've had a knee replacement despite the fact that it's very good at relieving their pain. It won't restore their function quite as well as a half knee replacement. The final advantage of a half knee replacement, which is suitable for about a third of patients with knee arthritis, is the smaller incision, the less damage to the surrounding tissues while the surgery is being performed, and consequently the quicker recovery and quicker return to full activity. This particular knee, as in most knee replacements, is made of a combination of a very hard metal, cobalt chrome or titanium, and a plastic insert which is high molecular weight polyethylene. These particular materials have been designed and have a long history of longevity and reduced wear. As you may have read in the press or in any medical literature, there are different materials that are available, such as ceramics and ceramic metal alloys, but we don't use these in the knee at the moment as they have a very short history and we don't quite know how they're going to perform in the long term, whereas this particular knee has a very good survivorship at up to 20 years. Likewise, with the types of knee we're using here, full knee we're using here at Hillingdon, we expect your knee replacement, whether it be a full knee or a half knee, to last you between 10 and 20 years, largely depending on how much activity and exercise you do with the leg.